There's really only one answer to why measles comes back, and that's because people aren't vaccinated. It's a very simple story. The best way to prevent measles is to get the vaccination through the MMR is the vaccine that we use here in the United States. We also have an MMRV, which also vaccinates against chickenpox. Both of those are safe and effective vaccines and are the only way to prevent individuals from getting measles, but also to prevent measles from spreading in our communities, right? As soon as the number of unvaccinated people rise to a high enough level, again, it's like putting fuel on a fire, and eventually, a match is going to cause a large blaze, and that's what we're seeing in the US right now. My name is Matt Ferrari. I'm a professor of biology at Penn State and the director of our Center for Infectious Disease Dynamics. Pennsylvania Department of Health today announced that 2 people had died from measles infection in southeastern Pennsylvania. It's a really tragic outcome, but unfortunately not unexpected. Measles is a really deadly disease, and the more cases there are, the more likely there will be that someone will die as a result of it. About 20% of measles infections are severe enough to seek hospitalization, and somewhere between 1 in 3 and 1,000 measles infections will result in death, and that can be children or adults. Measles causes a whole range of complications. The disease itself, the acute disease, can result in severe fever, brain swelling, neurological complications that themselves can lead to death. But measles also can cause pneumonia. It specifically attacks the white blood cells, the immune cells in your body that your body uses to fight off other infections. And so if you've had measles, you're more susceptible to the things that cause pneumonia, or you're more susceptible to the things that cause diarrheal disease. That can last for weeks or months even after a measles infection. So we've had over 2,800 cases in 2026 alone, and that follows on 2,000 cases in the year before. That's more than 10 times the number of cases we've had in any year in the past, right? So this is an extraordinarily severe and widespread outbreak that's affecting communities all across the country. This is an enormous increase from what we've seen anywhere in the US in recent years. I mean, measles was eliminated in the United States for a long time. We always had a couple of cases, usually travelers leaving the United States, coming back, and maybe exposing 1 or 2 people. But now there's been enough non-vaccination, and oftentimes that non-vaccination is clustered together in communities where, either for religious or other ideological exemptions, the people who are non-vaccinated tend to be together. And that means that when one case happens, it can spread to others and to others and to others. Populations lose their collective memory. We haven't had measles and, in fact, many vaccine-preventable diseases around for a long time. We don't have the experience of knowing people that have been sick or harmed by these diseases. The reason for that is because of the success of our vaccination programs, our public health programs, our outbreak response programs. So we're a victim of that success now, and as a result, we're not maintaining the level of vigilance that is necessary to maintain high levels of vaccination to prevent these outbreaks from spreading. The Pennsylvania Department of Health has actually changed its vaccination recommendations because of the pressing risk that we have right now. So in particular, they're recommending that children accelerate their vaccination doses. So if you have children that you're expecting to vaccinate a few months or years from now, you might talk to your healthcare provider about getting them vaccinated now. It's safe and effective to vaccinate children at as young as 9 months. And so we're recommending that children get vaccinated early because kids are most at risk of severe disease. We're also recommending that adults pay attention to their vaccination history. If they're not sure they've had 2 doses, then they might want to seek that second dose. If you're as old as me and you were born at a time prior to 1989 when we were only giving 1 dose at a time, then you might want to seek getting a booster dose, which is what I've done. At the end of the day, measles is a serious disease. I've been saying that for years. Scientists have been saying that for years. 250 children under the age of 5 die from measles every day globally. Every day, 250 children are lost. That's a severe health problem, right? We haven't seen that locally in the United States for years because we've had an effective public health infrastructure, because we've had lots of people vaccinated. But now we're starting to see that risk coming back to our communities, and it's going to be palpable now how severe this thing is.